Hello, everybody. Welcome for this third webinar of the Asia Pacific Social Protection webinar series, which is a joint effort by the Asian Development Bank and socialprotection.org together with other partners. This webinar is on aging and disability, delivering effective social protection, and it's organized in partnership with the UNPRPD, the UN Partnership on the Rights of Persons with Disabilities, HelpAge International, the International Labour Office, the IPC Policy Center, and UNICEF. This webinar series is part of an initiative with an online community on the topic to share information and foster discussion on social protection in Asia social protection in general. We invite you to join the Asia Pacific Social Protection online community to connect with our colleagues, receive bi-weekly newsletters, and keep updated about future webinars. At the end of this webinar, we will have a networking cafe, and we invite you to join us for bilateral and group discussion. This event is recorded, and you will find on the page suggested reading. We also have, for this webinar, sign language interpretation and live captioning. You can see the sign language interpreters who have been spotlighted, and you can activate the live captioning by clicking on the CC closed caption button. As I mentioned, don't forget, if you are available, to join us in the networking cafe at WonderMe. We will be given instruction at the end of this webinar for a bit of a networking session. So this webinar is particularly timely. With the COVID-19 crisis, we have seen that the model of support for aging population with functional difficulties and difficulties in daily activities or older person with disabilities have been inadequate. Over-reliance in institutional care have led to very dramatic situation. We have seen in Europe, in North America, some of the highest death rate of the COVID have been in home care, in care home for older person. But also over-reliance on family and informal care has led to significant disruption of the support that older person with functional difficulty may have. And we would like today, with different experts, actually consider what are the different issues that are related to old age, disability, and social protection, and what are the different pathways that we can explore to actually support older person with disability to live in the community with the rest of the support they need. To do that, we have with us Diana Hitchcock, who is the Global Disability Advisor of HelpAge International. She is an inclusion and rehabilitation expert that has worked both in emergency and development setting, with a focus on developing community-led and home-based care services. We have also Charles Knox, a social protection consultant with over 13 years of experience, including with HelpAge. He is currently supporting various activities under the ILO UNICEF UNPRPD program on inclusive social protection for persons with disabilities. Meredith Wise, who is the Senior Social Development Specialist at the Asia Development Bank. She is specialized in aging and care, and she has extensive experience working in the Asia Pacific region on the issues related to adaptation to population aging and older person with a specific focus on long-term care. And finally, we will hear from Rafael Guerrero Osorio, who is the research coordinator at the International Policy Center for Inclusive Growth, the IPCIG. He is also a senior researcher at the Brazil Institute for Applied Economic Research. He has worked on studies and published work on poverty, inequality, and social policies about Brazil and internationally, and he served the Brazilian federal government in different capacities. We encourage you during the presentation of our colleagues to use the Q&A and to ask questions in the chat or post comments. We will be monitoring it and curating those questions for our speakers. We will, so after each presentation, we will have a very short clarification window if you have any specific clarification question about the presentation. And at the end, we kept a certain time for Q&A session, and we really encourage you to engage. So without any further ado, I would like to invite Diana to take us to this first presentation about older person with disability. Diana, the floor is yours.
Thank you. Thank you, Alex. So hopefully, let's have a look at some of the issues that around disability and older age. So my aim in this small session is to set the scene, really, so that we can start to really dig a bit deeper into who are older people, because this is one of the challenges that we commonly face in trying to link with the social protection services, etc. So I've got a slide up here, as you can see, which shows the dramatic growth of older people between 2014 and 2050. And you can see from the green to the orange, the incredible numbers of older people who will be in the regions, in the globe, in 1950. So we're talking about 30 years from now, and that's not very long. So it's really something you can't ignore. And these figures, I think, need to be shared more, but yet they're not good enough because it doesn't demonstrate the complexities of older age. Next slide, please. So what I've got here is basically information taken from the social protection guidance that's just been published, because some really concrete points there that I think help to unpack it more. So I've just picked out a few. So these are very significant figures that demonstrate the prevalence of disability increases significantly with age. So I like this figure. 46% of older people globally over 60 live with a moderate to severe disability. And that is astounding when we have the global figure for people with disabilities as 15%. It already says where the majority of disabilities lie. We also know far more than we did a few years ago that the level of disability is higher in lower and middle income countries. And that's has been a bit hidden and needs to come more out in the open with better data collection systems. We also recognise much better that the elevated levels of disability in older age reflect an accumulation of the health risks across the lifespan. So we can't ignore that as a younger person, what health issues you are experiencing accumulate and exacerbate as you get into older age. And we also have to respect that a lot of disability is not reported in older age. And that's one of our big challenges. Older people don't necessarily want to admit they have a disability. And that's often related to many underlying social stigma, discriminatory practices. So this, again, is something we have to think about when we try and unpack the more appropriate ways to provide adequate services. Next slide, please. So I think these two graphs really help to unpack and strengthen those points made before. You can see two slides, one from disability prevalence from age groups from 15 up to 85. And if you can cast your eye along the bottom to the 60-year age ranges, you can see an incredible growth in the graph where disability prevalence increases in older age. And that's in 3 countries, Uganda, Vietnam, and Bangladesh. And so it's not like it's a one-off thing. It's this amazing piece of research really helps bring home the points. Then on this other one on the right-hand side, the proportion of older people with functional limitations is compared with the difficulties and activities of daily living, which is again very important to look at and unpack these two areas. So if we look at the functional limitations, a lot of people are managing but some are not. And that's important again. We're looking at ADL skills. These need to be incorporated into how we also address people's needs in older age. So I think these two graphs are pretty self-explanatory, and there's a lot more can be read in the document if you're interested. So next slide, please. To just reinforce some of the points, I was just going to share some other important dimensions of disability in older age. When functional limitations are acquired, many older persons only acquire functional limitations in later life. Others will have them living with disabilities from earlier ages. A sentence that may seem confusing, but this is one of the big gaps. I may have a disability from birth or acquired during my life course, but I also may have a disability in later life following a health incident or other complications. So these two aspects really also need to be unpacked to fully encompass the appropriate support provided to older people with disabilities. And the other area is often not looked at is the issue of older men and older women, what their different ways of coping with disabilities. And these also, I think, I would say are not well researched, and much more needs to be done there. It's very clear that wherever you live and how you manage your disability varies considerably. Globally, you see many different approaches and ways of coping with the consequences of a disability, especially where you have no services. Another point, I was just wanting, the last 2 points, is a common feature of disability in old age is often the multiple health conditions and the functional limitations. We have a lot of research now and surveys where we meet people with 4 or 5 disabilities as a consequence of their complex health conditions, of which that may be 2 or 3. And that in itself is staggeringly complicated when you want to prioritize the type of service to support all these multiple needs. But we also recognize that it's not propping up a system to do a one-size-fits-all, because everybody sort of life's course of disability changes drastically over the years. So you might be at 60 pretty active, by 70 having a few aches and pains and not managing, and your functional limitations are going downhill. By the time you're 90, you might be bedridden. So you've got to really consider those aspects of the diversity within older age. Next slide, please. So I thought what I would do is to just look at the International Classification of Functions. I think it unpacks it really well. So if I have a talk to Ari, he's now got dementia and a chronic respiratory condition. He's about 75. So that's his health condition. So then what's the impact of the health condition? That affects his body function. So he can't get out of bed without support, and he needs help to eat and drink. So then activity, having a daily plan to support his meals, needs to help to go to toilet and take his medication. So how does that impact on his participation? He has limited ability to make decisions. He's dependent on his carers and who are family members to support his basic needs and requests. That's the best he can do in this situation. And personally, I think this is one thing that matters to me so much. He's struggling with a sense of dignity and well-being and feels a burden. And that is one of the issues. It is really difficult to manage in supporting his needs. So, and then the last point, as you look at the ICF model, is the environment. He has an adapted home environment to support himself, but it may not be good enough in, say, 4 or 5 years' time as his needs change. But I think this type of approach, looking at the ICF, is very useful to be able to look at ways you can approach. Right, next slide, please. So I think I want to summarize there, really. I was hoping to talk about another lady there, Irina, who didn't have such complex needs. And her ICF was more on building her independence and autonomy. And that's very important to see that there's so many differences within older age that we have to consider. So just to summarize on this last slide with a few points, the data gaps here in the high and low income countries are very different to be able to really assess health services and social protections. So we've got to really consider what type of approaches we can use to be realistic. And both older women and men, sorry, someone has decided to knock on my door, so apologise. Both older men and women women with disabilities face discrimination and exclusion. And this is really something very hard to address. We see a lot of double discrimination. And I have to say, women with disabilities are extremely more affected than men, as we see in our work, in our daily work, actually. And we need to understand these issues much more. And a point really to take home for me here is we have such a lot of systemic ageism and ableism that create barriers to strengthening social protection systems. These are some of the issues we really have to look at much more in depth if we want to take this work forward and make sure we leave no one behind. On that, I'll stop there, and thank you very much.
Thank you very much, Diana, for this presentation. Indeed, an aging world, an aging population who acquire functional difficulties as they go. And as you say, I think one of the key challenges also for us is people with disability who do not self-identify as person with disabilities. And it creates this kind of new territory for many countries where there is actual demand and a need for support who doesn't frame itself in usual terms. And it's ask questions to social protection system and challenge them. And to try to lay out some first answers, or at least explore further those questions, we have worked together, ILO, UNICEF, the Center for Inclusive Policy, HelpAge International, ADB, in a paper that you can find online. This is a draft, an edited draft for consultation. So we really encourage you to download the paper, look at it, and you can send us your feedback, your comments, and we will finalize it later this year. And to get into those key questions related to social protection, I would like now to invite Charles to get us through some of those key data that can provide some light on the issues and also explore some of those key points. Charles, the floor is yours.
Okay, thanks so much, Alex. Paola, I think you need to unshare, and then I will share my presentation. So yeah, good. Well, hello, good morning, good day, good evening, everyone. It's really, it's a real pleasure to be able to kind of be part of this session and share some of this thinking. As Alex said, what I'm going to share is part of a kind of brief, a paper that I was involved in developing with the various colleagues on this question of old age and disability and social protection, which is it was a really it's been an interesting kind of opportunity, I think, because it's something that I think many of us who kind of work in this space have grappled with a bit in the past, and it's been a good space to try and kind of think through and clarify some of these issues. But as Alex said, I think we'd really appreciate feedback on the paper, both in this session and through any kind of feedback on the document itself. So what I'm going to talk about briefly is first try and kind of define a bit more precisely what we see as the role of social protection for older persons with disabilities. Secondly, to talk a bit very briefly about the status quo in lower middle income countries. What are some of the trends in terms of, what kind of schemes or social protection systems exist in relation to the different kind of needs. And then very briefly, just to set out what I think we've seen as something of a kind of pathway to strengthening social protection systems for older persons with disabilities. So to start off, I wanted to go back to one of the the charts which Diana had shown, and try and elaborate a little bit on it, which was this chart which showed in the case of Thailand, and this is just one country, one would find similar things elsewhere. And in the case of Thailand, looking at different kind of levels of disability by age. So as we see in Thailand, the proportion of people with any functional limitation increases significantly from the age of 60 up to those who are 80 plus. And in the meantime, the levels of people with difficulties in terms of the activities of daily living, so that's difficulties more with things like bathing and dressing, and some of those kind of self-care activities, that's much lower, but does increase at more advanced ages, particularly over the age of 80. So what does this mean? What are the kind of consequences of this from a kind of social protection perspective? Well, I think a kind of key one is the impact on the kind of engagement in the labor market and the kind of ability, the opportunities to earn an income. And we see this in country after country, that levels of employment, of labor force participation of older persons are significantly lower than at younger ages. And this again is the case of Thailand, but it's reflected really in countries across the globe to varying extents. We see that it falls significantly above the age of 60. Now there's a couple of maybe nuances to that. One is to highlight that actually in many low and middle income countries compared to high income countries, many older people do continue to work. In Thailand, it's about 40% in total, though that's mainly concentrated at the kind of younger old, if you like, those in their 60s. Another interesting thing just to highlight is, as well as the fact that labor force participation for women is lower than men in general in most countries, often you see, as in the case of Thailand, that the levels in a sense kind of begin to fall at an earlier age, but before the age of 60, whereas you see for men, it's that difference between late 50s and early 60s is much more pronounced. So that, the first point, I guess, is to highlight that disability is one of the major factors that is contributing to the lower access to employment for older persons. It's obviously not the only factor, as Diana alluded to. There's factors of discrimination. There's also a question of choice. People may be choosing not to work at those more advanced ages. But it's very clear that disability is a key factor, which is one dimension of what we're looking for social protection systems to respond to it. In absence of adequate social protection, that reduced income can contribute to household poverty, also to the issues relating to the dignity and autonomy of older people if they're heavily reliant on others for their financial support. So that's a bit about the link between disability and employment, and that, as I say, that capacity, those opportunities to earn an income. But as Diana also alluded to, there is, in a sense, a kind of another dimension which is pointed to by this question of the activities of daily living, is that, particularly in this case, it implies a certain proportion of older people, particularly at more advanced ages, and those with more severe disability, are likely to require other forms of support. So particularly in this case, we're thinking in terms of different forms of care. So I guess that captures really what I want to go into in the next slide, is that in this context, there are different kinds of different kind of levels of support we're looking for the social protection system to provide, which are delivered by different kinds of instruments. So the first, and this aligns with a broader framework that has been developed under this joint UN-PRPD project on social protection and disability. But we've kind of customized it a bit for the old age and disability question. But there are kind of three core levels we're looking at in terms, or kind of functions we're looking at in terms of social protection for older persons with disability. So the first is income security, and this really relates to this question of the barriers that people face to being able to work and earn an income. And providing this income security, as we put here, it enables access to a kind of common basket of necessary goods and services, if you will. So this isn't specific to older persons. It's to ensure people have that minimum income to live it in dignity. And in terms of instruments, what kind of instruments would we see as providing this? We'd be thinking fundamentally about old age pension systems, both those that might provide a minimum income, kind of a floor of income, if you will, but also schemes that provide some level of income replacement, earnings related benefits in terms of contributory schemes. Now, I think a key point we're trying to address in the paper is it's easy to many people might leave it there in a sense. Well, the pension systems, those are the schemes that are there to address older persons and support older persons with disabilities. But we're also really emphasizing the other key levels. And the other is really covering those kind of disability related costs that older persons with disability will face. And they can relate to care, they can relate to assistive devices, they can relate to specific needs in terms of transportation. For example, they can relate to other forms of personal assistance. Now, there are different kinds of schemes which can provide this kind of support and maybe mixed in different ways. So one is cash as well, in addition to old age pension systems having some kind of supplementary disability inclusion support allowance, for example. Similarly, this support can be provided in kind. It could be through community support services, like long-term care, home visits, rehabilitation. To an extent, it can also be supported through different kinds of concessions, so discounts on public transport, for example, tax exemptions, and also on the direct provision of assistive devices. So that's the second layer. And then the third layer is really effective access to healthcare. Now, this is obviously something that's relevant for all people, and particularly all people with disabilities. But yeah, we see very clear trends that older persons have significantly higher healthcare needs, particularly, which is linked to the levels of disability. And therefore, it is critical to have health systems in place that address those needs in an affordable way. Otherwise, this is likely to become a significant additional disability-related costs to older persons. So in a sense, these are the kind of three levels, and in the rest of the presentation, I'm going to talk a bit to these three different levels or kind of functions and the schemes within them and what exists in low and middle income countries. So how are low and middle income countries doing in terms of the kind of social protection provision that is in place according to these dimensions? And I mean, a key starting point, I think, is to highlight that the scope of systems in place remains quite limited. Now, this table, which I'm showing you here, is actually from a piece of research that we've been involved in on the social protection response to COVID-19 for persons with disabilities. So it goes beyond old age, but it focuses on a number of case study countries. But this, I think, highlights some important dimensions. So we looked here, we're trying to kind of classify, do schemes exist? First, we're looking at kind of income security side of things. So what we found in these countries is, in general, a kind of scattering of different schemes exist or are in place addressing income security, either through kind of mainstream social assistance targeted at poor households. In many countries, specific non-contributory disability benefits, who are focusing on the kind of tax finance schemes, and also non-contributory old age pensions. So these countries have generally have some kind of scheme in place. The important caveat, and there's a few caveats here. One is that this is not a kind of representative selection of countries, and probably many of these were chosen because there was more going on, so they're not representative of the picture as a whole. And also many of these schemes in place have many limitations, not least in terms of coverage. Many are targeted at say at the very poorest and don't cover many older persons or persons with disability at all. But broadly, there's more going on in this space in terms of income security than in terms of disability-related extra costs. So here we've really got more focused on the kind of cash benefits, but are there different kinds of cash benefits in place that specifically relate to those extra costs of disability? Now, the most common that are in place are forms of kind of child disability benefits. But when it comes to those of working age and old age, and that's the kind of second column there, it's much more rare to have kind of supplementary schemes in place that provide cash support in addition to, say, an old age pension. And similarly, few countries provide a specific caregiver benefit or specific personal assistance. So I guess that the overarching message here, when we look at across a broader range of countries, is income security. There's more going on there, but still many limitations, as I'm going to talk about. In terms of the question of addressing disability-related extra costs, that's much more limited. So let's look a little bit more specifically. So in terms of the income security side of things, and thinking now more specifically about older persons, where are we there? Well, on the face of it, if we look at the ILO's recently launched World Social Protection Report, protection of older persons and coverage of pension systems is comparative to other branches, contingencies of social protection is pretty good. So we're talking about 78% of older persons across the world receive some kind of pension. So that's people over the statutory retirement age of their country. However, coverage is significantly lower in low and middle income countries. So we see to the right there, around 40% of older persons in lower middle income countries receive some kind of pension, and just 23% in low income countries. And those that do in those countries, many of them are likely to be through the contributory system. So the extent to which lower middle income older persons with disabilities are covered by those schemes is likely to be even lower. Another key issue, which I'm going to speak to in a moment, is that the benefit adequacy is often low. Just to say 78% of people are covered doesn't necessarily mean those benefits are adequate, and we see in many countries those benefits are very low. Now that relates to kind of tax finance social pensions, as we call them, which can sometimes have very minimal benefit levels, but also it's an issue that relates to contributory schemes. The benefits provided may not be sufficient, particularly for those with low contribution histories. Similarly, in many countries, we have systems such as provident funds, which might provide lump sum benefits, which we know have a tendency to kind of be depleted in the early years of retirement and not really provide a dependable income into old age. So some positive signs in some respects in terms of income security, and this is an area where there's been improvements, I think, in recent decades, but also major gaps. I guess the only caveat I've got there is, even where benefits small, they're often a lot better than nothing, and you can see they can have some quite transformative kind of impacts on people's lives, even if they're not at the level of adequacy one would hope for. So then what about healthcare? Well, I think it's well known that healthcare services are in health systems in low and middle income countries have major gaps and shortfalls. And that relates also to persons with disabilities, or even more acutely to persons with disability and to older people. It's worth kind of highlighting, I think, the different levels of costs. That relates to direct medical costs, which we might have in mind more immediately when we think about universal health coverage and different forms of kind of health financing and subsidized health insurance and these issues. But it's also important to kind of highlight the non-medical costs, which can be significant, particularly for older persons with disabilities, such as transportation, accommodation, and personal assistance if they need it, if they have additional needs. Also, those indirect costs. So not just the lost kind of income of, say, the older person with disabilities from needing to seek care, but also the lost income if they need support, say, from a family member. There's also a major challenge in terms of appropriateness of the care provided. It's common in many low and middle income countries that health systems are more orientated towards short-term illness, communicable diseases, and not necessarily the kind of chronic NCD type issues faced by older persons. And I guess one thing I also wanted to mention in terms of the health side of things is this is quite strongly linked to issues of, I'd say, kind of the dignity and autonomy of older people, and being able to afford these costs or access these services can have quite, I'd say quite a kind of distinct role, and it's something that comes out quite a lot in the qualitative work with older persons who have, say, limited income security. Because while I'd say one tends to find that older persons may be in a relatively better position to access to receive support from family members in terms of accommodation, a shared home, food. Often it can be quite difficult, I think, for them to justify to themselves and to family members access to healthcare, being that that's a real individual expenditure. It's not a kind of pooled set of resources in the case of, say, food or accommodation. And we see this a lot, as I say, in qualitative work. And this is just one case from Mexico, which echoes a kind of message one sees of people talking about the kind of shame of having to ask for the cash for that individual support in terms of health. This is why I think systems that address those health expenditures are particularly relevant. Okay, so what about disability-related extra costs? I mean, cash benefits in place for those costs, which I'll give some examples of, are very limited in number. And very few countries have those supplementary benefits on top of, say, old age pensions. And to an extent, that links to a concern about kind of double dipping, this idea, well, you're already getting a benefit, so you don't need another one, which doesn't really kind of recognize the different levels of need and the kind of diversity of the situation of older persons, particularly in terms of the severity of disability. In terms of kind of care and support services, provision of kind of formal care services care and support in-kind services to older persons is limited in most low middle income countries. That is something that's primarily left to family members, which in reality is primarily women and girls, which has strong implications for female labor force participation. And we know that the quality of the care can also be limited in terms of the levels of training people have. That can also relate to where private care is sought and that there isn't the adequate kind of labor force in place. And I guess a point that the paper highlights, which has been made elsewhere in many ways, I think 2 points: that for a greater investment in this area, on one hand, it can support building kind of kinds of care and support systems which are more conducive to supporting the kind of dignity, autonomy, and participation of older people. And this is really saying that actually an investment in this area can build systems that perhaps go in a different direction from the way many high-income countries went through, at least some years ago, in terms of a focus on residential care. That actually one can start by building these systems in a way that supports care in the home and care in a way that gives older persons with disabilities choice around the care they're provided. But there's also a kind of, all of this links to questions such as the care economy and the kind of future of the labor market, the future of work. So there's an important link there. Maybe just the kind of final substantive part is to say, well, we talked about these different kinds of schemes in place. How adequate are those that exist? I wanted to kind of pull out a few examples of countries that are, let's say, doing a little bit more. So these are all countries that have both some kind of old age pension system in place, providing fairly kind of, all these countries have fairly high coverage non-contributory tax finance schemes in place, but also in addition either have a kind of differentiated benefit level, which means it's higher for persons with disability, or a kind of separate supplementary benefit. So the first few here, you have Mauritius and Georgia, which provide additional benefits over and above their universal tax finance pensions for persons with more severe levels of disability. South Africa has a similar approach, in addition to the fairly high coverage old age grant for persons requiring regular attendance, regular care. Thailand, a slightly different model. There, it's simply that the disability allowance, which is kind of paid to all persons with a disability card, can be paid in addition to the old age allowance, which is a kind of near universal scheme. And then Vietnam, within its system of social allowances, there is a higher benefit for older persons with disability who are over 80s than those over 80s that have a lower level of disability. So what do we see in terms of adequacy? And here, the first chart we're looking at is the benefit levels as a percent of GDP per capita, which is what we often use to compare benefits across countries, to look at the, you know, in a sense, the adequacy relative to the level of economic development. Now, when we look at the blue, Georgia, Mauritius, and South Africa, those are the kind of benefit levels of the social pensions, the old age pensions. Those are relatively good by international standards, above 20% of GDP per capita. The global average is more like 17%. Thailand and Vietnam much lower. And interestingly, also in Georgia, Mauritius, and South Africa, particularly in Georgia and Mauritius, the additional benefits also, not insignificant. So we're seeing that in Georgia, the additional benefit is it's more than 50% of the basic old age pension. Now, there's what we're not looking at in detail here is whether that those benefits really address the disability-related extra costs, the costs of care, for example. That requires more kind of in-depth analysis. But we can see that they're clearly not irrelevant. Another way we can look at this is looking in the kind of absolute terms. So we're looking at in international dollars. Again, we get a picture that Georgia, Mauritius, and South Africa, kind of the benefits are generally higher. Those black lines are the kind of relative, are the international poverty lines for the given country income group, whether the kind of upper middle income, lower middle income. And yeah, we see those three countries are in excess, and then the additional disability related benefits even provide a further supplement. Again, we see that Thailand and Vietnam is interesting, even with the combination of those two benefits, but both countries, the overall benefit provided, even for a person with severe disability, is below the kind of relevant international poverty line for that country income group. So there are some clear limitations in both those countries in terms of the adequacy of benefits. So just having a multi-layering of benefits, I guess, doesn't guarantee that they are really adequate to either provide income security, let alone those that cover those additional disability-related extra costs. So just to kind of summarize, what might the future look like, and what are kind of directions for improving this situation? And I guess the way we've kind of seen it is as a priority, the kind of foundation for addressing issues, of disability in older age, universal pension systems and access to healthcare are really key. There is some momentum on those already, particularly, I guess, in the field of health, but also in the kind of expansion of pension systems in recent years that can be built on. But this provides, a kind of foundation. Obviously, there's a need to progressively expand the adequacy of those systems, say pensions, so that they really provide some level of kind of minimum income security. However, these systems can be built in a way, even at the early stages, that kind of begins to integrate some kind of tailored support for older persons who have disabilities. So that can be through some kind of top-up benefits or differentiated benefit level for persons with more severe disabilities. It's making sure healthcare systems are responsive to the specific conditions that the older persons with disabilities face. Also, in terms of kind of financial protection, social health protection schemes, one common approach has been that in the progressive rollout of those schemes, older persons and persons with disabilities are kind of prioritized. So that can fit within that approach. But as I say, then a kind of longer term process is to progressively build up more comprehensive sets of mechanisms that really go beyond, I guess, the just healthcare and pensions. It's looking at in-kind care and support services. It's looking at kind of more substantial additional cash benefits, and also kind of concessions and discounts. So I think I will leave it there. And yeah, looking forward to the discussion. I'll also check the chat if there's anything.
Charles. Yeah. Thank you very much, Charles. Don't leave right now.
I'm not leaving, don't worry.
No, I have two questions.
Okay,
for you.
Yes. Yeah.
Clarification question. The first one from Louise, who is asking overall, globally, if we look at low and middle income country, are disability allowances and old age social pensions or allowances, are they usually poverty means tested? From the overview you've done, have you seen a trend towards poverty means test, or a trend towards, let's say, towards universal schemes?
I mean, I think it's a mix, really. There are examples, yeah, I mean, there are examples of both. I haven't got the numbers to hand about the exact mix. But yeah, I mean, some countries that have more means tested approaches, some have more universal. I mean, I guess I would characterize one I think interesting trend is this. I mean, the countries that have universal or high coverage old age pensions, it's not uncommon for them to have a similar approach on the disability side as well, though it's not always, you don't always get that alignment. And I think another interesting thing that is striking about the country examples that I've kind of pulled on here is, yeah, when we look at the countries that have seem to be doing something in terms of the kind of providing the supplementary benefits, it does appear that those are the countries that have more universal or high coverage kind of tax finance schemes in place. So Georgia, Mauritius have universal schemes. South Africa, it's means tested, but high coverage old age pension and relatively high coverage disability allowance. Thailand as well, it also has a kind of a more universal scheme. So there seems to be some tendency that's the countries that are having a more universal approach that are starting to look at those kind of differentiated levels of benefit, where that seems more rare, where there's kind of means tested approach.
Thank you very much. Actually, the second question is about, from Arin, is about the fiscal impact of increasing benefits in low and middle income countries. But I may keep this question for after the presentation of Meredith, who will talk to us of the Social Protection Index. I think we can engage in a conversation about that, which I think is in the mind of everybody. Thank you very much, Charles. And I will now ask Meredith to give us some insights or first reflection on this new data collection exercise that the ADB has done with the Social Protection Index. Meredith, the floor is yours.
Thank you, Alex. So yes, I wanted to bring the discussion back to specifically to the Asia region. Next slide, please. And just to highlight that, as many of you know, ADB every 2 to 3 years does issue a social protection indicator. And this is really a data of social protection expenditure across Asia and the Pacific. And it really tries to analyze how much is being spent on social protection, how many people are being covered by social protection, and really the value of that, of the benefits received. And this year, in the data collection that's currently is being finalized and we're in the analysis stage, this year there's been an intensive effort to gather data on persons with disabilities and who are benefiting from social protection policies, and then try and calculate the coverage and the benefits. Next slide, please. So just to highlight, you know, we're in the middle of this analysis, and the reports and all the country reports that back up this analysis will be issued next year. But just to highlight some of the sort of key challenges sort of being faced in this. So this is highlighting based on national statistics, official national statistics, the disability prevalence rates among the different age groups. And you can see, you know, even from this, you know, in most countries, obviously, as has been highlighted in the other presentations, unsurprisingly, the grey line, the population over 60 years old, is the highest. There's a higher rate of disability prevalence for the older persons. But you can see some sort of odd anomalies. You know, we have Pakistan and Sri Lanka, which seem to have extremely high rates of disability, again reflecting the way disability prevalence is being calculated. But on the other side, you've also got some anomalies, perhaps in Afghanistan and Georgia, where the rates of disability in older age seem to decrease, and that's largely due to the use of administrative data as opposed to sort of the Washington Group questions in terms of assessing persons with disabilities for disability allowances, etc. And when that transfer to old age and old age pensions or so forth, or non-eligibility for disability benefits comes in, then the numbers decrease. So this is one of the key issues in calculating this data, is really the wide variety of data. And whilst out of, I think there's a number, about most of these countries have used the Washington Group questions, we're seeing increasing use of the Washington Group questions, there are still some anomalies in this. Next slide, please. Just to highlight, and I think this is many people on here have sort of realized when we, you know, obviously just looking at aging in the Asia Pacific or the Asia region specifically, obviously Diana highlighted the sort of regional trends, but we can see there's huge variation within the region. And of course, people are very familiar, you know, that Japan, Korea, Singapore have very high rates of aging population, but we can also see, you know, there are sort of countries, Georgia, Armenia, the middle incomes of Thailand, Sri Lanka, you know, these are all aging, have substantial older populations now and are aging very fast. So there's quite a lot of diversity in the region as well. I think the only other point to highlight again on this slide is the Philippines data, where the population with disabilities again seems a bit of an anomaly. It is quite high, and again it's to do with the way that prevalence of disability has been collected. The Philippines took a different methodology, so again challenges around data. Next slide, please. But one thing we did do during the collection of data for social protection indicator was collate country reports, and one country report which was highlighted as having quite a wide range of services, social protection services for older persons with disability, and it's been highlighted already, was Thailand. So just to elaborate a little bit further on this, I'd just like to share this slide. This is showing sort of the age distribution from now and to 20 years time. And obviously the two sort of marked points of interest, especially for the development of social protection programs, is one, obviously the decrease in the working age population. It is quite a marked decrease, and the corresponding increase in that older population. And as we can see, there's quite a gender difference as well. That's taken through into old age. So that's really the sort of the situation that Thailand is facing, the population demographics over the next 20 years or so. Next slide, please. And so Thailand does have a range of social protection programs for persons with disabilities and for older persons with disabilities. It's already been highlighted that they do have that pension tested social pension. And one thing that's quite unique about Thailand is that it does increase over age. As Charles has highlighted, you know, the working people remain in employment to the 60s, 70s, so they no longer can work, and that increase in the pension at age 60, 70, 80 and 90 is a way of a sort of adapting to that. There's also the disability allowance, and as has been highlighted, if you're an older person and disabled, registered disabled, you are eligible for both. Of course, they do have assistive devices under the Universal Health Coverage Scheme and a home modification grant. So reflecting on Diana's case studies earlier, there is this sort of range of services. And then two key additional services that Thailand had, and they are quite unique in these, is really the PA program to support persons with disabilities to remain independent and engage in the community. And then for homebound persons over the age of 60-year-old, there is a community-based long-term care program, which is covered under the Universal Health Coverage Scheme as well. So if we looked at that ICF classification, we really do have a sort of wide range of social protection services and benefits for older persons with disabilities. Next slide, please. And just to give a sense of the sort of the coverage So the old age allowance, there's about 8 million persons who receive that. About 1.2 of them are registered as persons with disabilities. I think the other key here is the disability allowance, with about 2 million people registered and receiving that. The majority of them are older persons. So this is one of the challenges in developing the social protection indicator and really articulating what is the coverage and what's the value of the benefits, is that there are multiple persons covered by multiple benefits. And so it's very, very hard without very clear data on to really calculate and really assess what the coverage and value of the benefits are. The community-based care program for older persons currently reaches about 220,000 older persons, but as Charles has highlighted, whilst Thailand has this very broad range of services available, the adequacy remains an issue and a challenge going forward. Thank you. Next slide, please. So just one of the initial sort of findings from the social protection indicator collation of data that's going on now, and this is unverified, and this is just a first step. So we're sort of a bit cautious about sharing findings. We really want to go and verify these trends. But I would say, you know, I think a couple of things that we can take from this when looking at the old age expenditure across Asia and the disability expenditure is, one, you know, the trends aren't hugely encouraging. There is increase in expenditure, social protection expenditure on old age. There is some increase in expenditure on disability, but it's not a substantial increase. And I think the other thing to sort of highlight is, one, you know, the amounts being spent. We've got about 1.2% being spent on old age expenditure. This is compared with an OECD average of about 7%. And then in terms of the disability expenditure, we've got sort of less than 0.2% of GDP, again, an OECD average of about 2%. So in terms of what is being spent in the region, both on old age and disability and social protection, it is very, very limited. But I would just caution about some of that data. We really do want to go and check and verify and work out, especially why there seems to be a decrease in 2018. Thank you. Next slide, please. So this is just a very quick sort of preliminary findings highlighting some of the sort of issues that we're having around the data and really sort of calculating what is the coverage and the value of the benefits. But what we have seen is, you know, the increasing use of the Washington Group questions into household and censuses is really helping in terms of this data analysis. But when we get to the social protection programs and really analysing, you know, the coverage, it's quite hard. And, you know, extending that Washington Group questions into social registers, etc., especially into the mainstream programs, would be extremely helpful to analyse the coverage of social protection for persons with disability. As we've seen, disability across the age and the life course, hugely different prevalence rates, etc. So again, when we're talking about sort of disability and taking these sort of whole population prevalence rates, it has very limited value when we're trying to develop and implement suitable social protection programs. There's real challenge, and it's been highlighted by Thailand, is, you know, there's obviously substantial spending in mainstream programs for persons with disabilities, either poverty alleviation grants or specifically on pensions. And these could be used probably a bit more to sort of consider the extra cost of disability. But again, it needs really good data and understanding. And one thing that we really struggled with in this data collection and wasn't consistent across all the countries was the collection of expenditure on care and support services, which obviously Charles has highlighted is a key part of social protection for older persons with disabilities. But the challenges in collecting data on that, when sometimes it's sort of monitored or administered at a local level, at a national level, through a lot of NGOs, etc. It's very hard to collect good data on that as well. So that is something that we would be looking forward to in future rounds to really try and improve and strengthen. Thank you.
Thank you very much, Meredith, for those points. So coming back, there were some questions around the percentage of GDP spent on social protection for older persons with disabilities in Thailand. Do we have those specific numbers, Meredith, with regards to Thailand?
In terms of GDP, I don't have it. I can have it by the end of the webinar.
Okay.
I think.
Thank you very much. One element maybe to come back to the question of Louise and figures that have been shown by Meredith. Some of the work we have done looking at South Africa, Mauritius, and other countries show that if you have a coverage, let's say in terms of disability allowance, if you have a coverage around 3% of the working age population, you would have a cost that is around 0.5% of the GDP. It seems to be a kind of numbers that reach. And if we look at the financing gap report of the ILO, that look at very blunt estimation of what would it take to have a universal disability allowance, the number comes for low and middle income country around 0.5% of the GDP. So it seems that it's a benchmark that is emerging for low and middle income countries, but indeed it's always difficult to really get to the bottom of those figures. Thank you very much, Meredith. A question also about the report, the social protection indicator report. So it's not yet out. When can we expect it? It seems that it triggered some interest.
So it should be Q1 next year. There is a database which has all the previous reports and country reports on, and this new one, yes, the analysis done by. So hopefully Q1 next year.
Thank you very much, Meredith. So we will one question or so from Artyom with regards to global estimate on prevalence of disability between male and female. So maybe Charles, do you want to take this question?
In terms of global prevalence of disability?
Yeah.
Yeah, I mean, I think the prevalence side probably isn't. I feel like Alex, you're probably more expert on this, but yeah, my understanding is that when one looks at prevalence, yeah, globally it tends to be higher amongst women than men, and yeah, particularly so amongst older women than older men.
Yeah, actually, yeah, indeed. If we look at the World Report, which is still the reference, the 2011 World Report, you have overwhelmingly, you have a huge difference actually globally, with much higher prevalence of disability in women than in male, meaning between female and male. And one of the reasons for that is aging, because it's not the only reason, but one of the major explanation is that women live longer than men. So as you develop functional difficulty in aging, then you would have, I think it was 12% of the male population would have functional difficulties, and 19% of women, of female population. Okay, I will now go to Rafael to make a deep dive in Brazil and look at some of the adaptation that or evolution that we have in terms of social protection scheme. Rafael, the floor is yours.
Thank you, Alex. So today I'm going to be talking about the old age and disability pension in Brazil. There's a lot to talk about, but I'm going to be focusing on targeting and services. So please, next slide. Hello. So first thing you should know about the old age and disability pension in Brazil is that it was established by the 1988 Constitution. So it's a constitutional right. People have the right to receive a monthly minimum wage if they or their families lack the means to provide for them or for themselves. So what does that mean in terms of values? In 2020, one minimum wage was 1,045 reais, which is something around $427, converted using the purchase power parity, power purchase, or whatever, the PPPs from the World Bank, the running PPPs based on the 2017 international comparison program. So it's a lot of money. I mean, it's a very good pension, particularly if you compare it with like Bolsa Família, which is the other large program targeting the poor in Brazil. So the benefits of the old age and disability pension is like 7 times that of Bolsa Família, the average transfer for Bolsa Família. So the Constitution defines that the value of the pension should be equal to 1 monthly minimum wage, but it does not define who are the elderly, who are the persons with disability, and what is family, and what is income. So all these other parameters for the benefício de prestação continuada, the name of the Brazilian old age and disability pension in Portuguese, we call it the BPC. That's how I'm going to be calling it throughout the presentation. So the Social Assistance Act, the Lei Orgânica de Assistência Social, is a law. It's like a constitution for social assistance, sub-constitution, defines the other parameters for the BPC. So poverty means that the family must have family per capita income below a quarter of the minimum wage. The age for the old age benefit is 65. And disability is defined as any impairment that will last for at least 2 years, regardless of the cause of the impairment. So for the definition of disability, there is a disability assessment, is based on international classification of functionalities, is done by a multidisciplinary team. However, the medical exam is always done first, and it should answer to 2 questions. So the first is whether the person is impaired, whether the person has an impairment. And the second one is whether the impairment is permanent or temporary. And temporary should be for at least 2 years. So if the person is considered impaired by the medical exam, then the person goes through an assessment by social workers. It's important to say that all those parameters, they changed since the BPC started in 1996. And some of them are still under discussion. Actually, there was a lot of changes this year that I'm going to present to you. Next slide, please. So some data about the BPC. In 2021, there were 4.7 million beneficiaries, 2.6 million were persons with disability, and 2.1 were elderly. This number has not changed much. In the last years, it has been floating around 4.6, 4.7. There should be an expansion with the recent changes, but the changes are recent, so there was no time for them to impact those number of beneficiaries yet. So the total amount spent with BPC was around 60 billion reais in 2020. Again, this amounts to $24.5 billion. I also put some information about the average days that the National Social Security Institute takes to process a benefit request. This is the time since the benefit request enters the system until a final decision is made, whether the benefit is going to be granted or denied. So if you count all the benefits requests processed by INSS including the contributory benefits, retirement pensions, death pensions, sick leave pensions, all types of pensions. They take around 147 days. This is the average in 2019. That's a lot of time. If you look just at the pending requests, there is those that were not did not reach a final decision. They were pending in average for 263 days. Well, it's a smaller percentage of the requests, but this gives us an idea that this average of 147 days cover a very heterogeneous distribution. So for the BPC, old age is 186 days. And for the persons with disability, it would take 290 days, and pending requests were in average pending for 475 days, more than a year. So you see here that there is there are some obstacles for processing the benefit requests of people with disability, and this is due to the shortage of physicians that work for INSS, because there are not enough of them to do all the disability assessments as they do the disability assessments for the contributory system as well. In 2021, 91% of the beneficiaries were already enrolled in the Cadastro Único, the Brazilian single registry for social programs. This is a very good advance, because in the past, BPC was out of the Cadastro Único. It had its own system. Only in the last 5 years, beneficiaries of BPC started to migrate to Cadastro Único, started to be enrolled in the Cadastro Único. However, due to the way that family is defined for the BPC, the Cadastro data still cannot be used for all individuals. There is a lot of ongoing discussion about changing the family definition for BPC, and I'm going to talk a little bit about that in the next slide. So the important thing here is that in 2021, there were very relevant changes in targeting and in the benefit design. And those were introduced to cope both with the Persons with Disability Act, the Estatuto do Idoso, the Estatuto da Pessoa com Deficiência, that is a law that was passed in 2015, and what is called the judicialization. I think this word is terrible. Hope you understand what I mean. I looked for the right translation, and actually it was judicialization of BPC. So as BPC is a constitutional right, if it is denied and the person is not okay with that, she can go to court and she can claim the BPC. And it can end up in the Supreme Court, as it is a constitutional right. So next slide, please. So part of this judicialization is due to disagreement with the result of the disability assessment. There are some issues also with the time to grant the benefit, because sometimes it takes too long for people to get the benefit. But most of the judicialization stems from disputes over the poverty line and how to conduct the means test to decide whether an individual has monthly family income below a quarter of the minimum wage. So the family definition implies the inclusion or exclusion of some household members. So the current definition says that the family of the claimant is his or her spouse, his children, any other minors that are legally under the guard of the claimant, or his or her spouse, and siblings, non-married siblings only. So this might exclude some household members which have income. So when you do the poverty analysis, those families, they look like inclusion errors because, I mean, you excluded someone that had income and that made that family poorer. Or you can also include household members. And this can go both ways. You can be including or excluding household members that have or don't have income. And this might result in an inclusion or an exclusion error if you compare to the poverty of the family as you usually calculate from a household survey or from the census, where you consider all the household members, not those that are in the legal definition of family for the program. So this has been discussed for many, many years now. Just 2 weeks ago, I participated in a workshop of the ministry that takes care of the BPC. And there are some plans to change the definition to make it the same definition as Bolsa Família, which is basically all household members count. And this would make the operation of the program from the Cadastro Único possible. Because as I said to you, because of this family definition, depending on who is the person responsible for the household in the Cadastro Único, you cannot identify the members of the family of the beneficiary. So for instance, if the beneficiary is a grandson in the household, it's very hard for you, and he's defined as a grandson. You don't know who are his grandparents, or who is his father, who is his mother within the household. It's hard to reconstruct this kinship relations within the household if the person is not ego in the kinship structure of the household. But anyway, this is being discussed, and in the past, what judges would do is that they would include or exclude household members as they saw fit to make the family fit the poverty criteria of the program. So for instance, there was an older brother that had some income, and if you counted the income of this brother, the family would not be poor for BPC. But then they would go to court and claim that this brother could not help because he had his own kids that he was supporting. So the judge would say to INSS that for this family, you should not count the income of this person. So this is quite complicated, but it happened a lot. Actually, in 2014, 25% of all the BPCs that were granted in that year were granted by court decisions. Income definition, it also changes a lot, what goes in and out, both by changes in the rules of the program and both by court decisions. So as with the family members, there would be inclusion or exclusion of certain income sources according to what the judge saw fit, or according to changes in the regulations of the program. I'm going to talk a little bit more about this. And also, there could be this in courts only, not by the rules of the program until 2021. Deduction of expenditures that were related to care-related or health-related, related to the impairment of the person if it was a person with disability. So, for instance, some family would have their benefit, would claim a benefit for a person with disability that needs a lot of care, has a high dependency ratio, and INSS will deny that based on the calculation of family income. Then the family would go to court and claim that they have some kind of health expenditure that is not covered by the national health system, or is not available in their area, or the person needs some expensive medicine. So the judge will tell INSS to deduct that expenditure from the family income and recalculate per capita income after the deduction, and then the family would become eligible. So that happened a lot, and the executive branch would question this in the court, but it was always losing. I mean, it was always on the losing side, because the courts tend to decide in favor of the least favored. So there was also this issue of the quality of treatment among beneficiaries of social programs. This is a quite tricky issue, but the Elderly Act in 2003, the Estatuto do Idoso, established that the BPC received by another family member shouldn't count as income, as family income, when you are deciding whether you're going to grant or not a benefit for an elder member of the family. So what happened is that persons with disabilities started to go to court and demand the same treatment that was given to the elderly. And soon, people like elderly couples where one of the spouses would receive a minimum wage benefit from contributory social protection would also go to court and say, look, if you have a couple or an elderly couple, they both can receive BPC because of the Elderly Act, but my wife cannot receive BPC because I earn a contributory pension. So courts started to decide that all those minimum wage benefits from contributory or from non-contributory social protection should not count as family income for BPC. And finally, in 2021, the rules of the program changed to accept this. Actually, the executive branch gave up, and now no minimum wage benefit will count as family income for BPC. What does that mean? That means,
Rafael, we are running a little bit out of time for your presentation. So if you could move to the adaptation that have been made, that would be really great. Thank you very much, Rafael.
Okay. So now people can earn, like, if you have 5 elderly members, all of them can receive BPC, and the same goes for persons with disabilities. So there's also this issue of the poverty line, whether it should be a quarter or half of the minimum wage. This is something that has a long history and cultural issues related to the tradition of poverty measurement in Brazil and the previous old age and disability pension. But I want to go over it. Next slide, please. So the change in poverty criteria that happened into 2021, after that, this is still not implemented. It will take some time to implement. There are many doubts on how to do it. But people in the income bracket from a quarter to half of the minimum wage are now eligible if they have a high dependency level and or regular expenditure with health and well-being. So they have to prove that the expenditure is required. They will have to prove that the expenditure is required for their well-being. And that the expenditure is with goods or services that are not covered or provided by the national health systems or national social assistance system, the SUS, they are universal systems. So, but till now, we have no instrument to measure dependency. This is being under discussion. I mean, actually, there is a good instrument to do that, but it has not been approved yet. And there is no deadline for implementation. There are no lists of what are the medicines or services that should be taken into account when granting the benefit for those that are in this new income bracket that was created pretty much in reaction to all this issue of judicialization. Next slide, please. So for persons with disability, there was also a big change regarding labor market participation. So since 2011, to incentivize formal labor market participation. The benefit can be suspended and resumed when the beneficiary is dismissed or after the end of unemployment insurance. We're talking about formal labor only. Apprentices were able to keep the BPC regardless of the remuneration they got for the apprenticeship. The Persons with Disabilities Act, the Estatuto da Pessoa com Deficiências, the 2015 law, established a special inclusion transfer that was to be defined, and that was finally defined this year, instituted in this year, though not implemented yet. So for BPC persons with disability in formal employments that have earnings up to 2 minimum wages, they will receive half of a minimum wage, monthly benefits. Those earnings and the inclusion transfer will not count as income for the granting of other BPCs in the family. It will not affect other BPC earners in the family. And the BPC can be resumed to the usual value if the person is dismissed or after the end of the unemployment insurance. Next slide, please. So I would talk a little bit about services. I know that my time is already gone, but it's just the 2 slides. So BPC is just a pension. There is a very restricted cash plus package of services for persons with disabilities, which is the BPC school and BPC labor. However, you have educational services for children and adolescents with disabilities provided by public schools. Goods and services for people with disabilities and the elder are provided by the National Health System, which is free and universal. Social assistance services are provided by the National Social Assistance System. However, public education, health, and social assistance, we know that there are many supply side issues, a lot of heterogeneity. Services can be very good, but it's basically a lottery. You got to be lucky to have good services where you live. It's not always the case, and some services are not available. Next slide, please. So in terms of social assistance services, there are basic services. The most important ones are those that are part of the cash plus package of the BPC school. So in 2007, there was a survey, and I see Alex, I have to conclude. Okay, I'm going to stop here. 2007 survey revealed that 70% of the school-age children were not attending school. So there are those local committees with education and social workers to monitor those beneficiaries and try to work for their inclusion. It's not present in all municipalities. And there is this component aimed at the inclusion in the labor market. So there was more about services that I could show you. There are some specialized services for the elderly and people with disability that need care. There are daycare centers and also services for those that have their rights violated. So for instance, adult women with disabilities are very prone to suffer from sexual violence. And adult males are prone to be abandoned. So there is a gender differential in the types of services that they receive, specialized services. I also had some maps showing that access is not uniform across the territory, but as I said, I'm going to end up here. So if you have any more questions, you can ask me later. Thank you very much.
Thank you very much. No worries. Thank you very much, Rafael, for this extensive presentation of a very critical scheme. I think many people in the field of social protection and disability have heard about the BPC. So I think it was really interesting to see some of the challenge and the evolution. We are a little bit short of time for the debate. We received a few questions that were mostly answered. I just wanted maybe to come back to one probably key question that we have, which is how do we address, and I think, Rafael, you addressed part of this with the evolution, older persons who have functional difficulties may not always self-identify as person with disabilities, so they may not seek disability-specific benefits. And how do we provide, nevertheless, this support? For instance, in France, it would be called dependency and autonomy services or benefits, because it's not called disability for older person. But I wanted maybe to go back and give 1 minute to each of the speakers to reflect on some of those issues. It can be from an angle of data or an angle of service delivery. How do we, what would be for you the way forward in addressing the needs for support and coverage of extra cost of older person who are de facto person with disabilities but may not self-identify as person with disabilities. So I will go first. So 1 minute for each speaker. And for all of you, please join us for the networking cafe afterwards. We will be able to continue the conversation. So I would like to ask Diana, if in 1 minute.
So a few points there come straight to mind. I tend to feel there's a lot of knowledge sharing needs to go on, because a lot of older people, and especially older people with disabilities, do not necessarily know about issues such as rehabilitation, the importance of rehabilitation to maintain their independence. They're not necessarily aware of what type of assistive product is useful to help them maintain their independence. So, and those sort of issues is not so much about the cost, it's about the awareness. And the other with the service providers, likewise, who provide rehabilitation and other types of related services, to be skilled up also to understand the needs of older people, which is also sadly lacking. And things also related to accessibility. Many services still are not accessible, to encourage people to come and use services. So, I mean, those are slightly different points that we've been alluding to most of the presentation, but those are the ones I wanted to share with you now. Thank you.
Thank you very much, Diana. Charles?
Yeah, I mean, it's an interesting question about how do you address older people with functional disabilities that don't self-identify? I mean, I'd say three things, or kind of three angles. I think one, this highlights the importance of that kind of universal pension system, because in it, I've often kind of seen, in a way, it's a bit of a blunt instrument in some ways, but having that kind of universal provision does mean that you're going to capture many people, including those who have some level of disability that may not be sufficient to, for them to apply for a specific kind of disability benefit or support. So that's one thing. I think I agree the labeling is important, that whether you call everything, couch everything in the language of disability, or maybe in terms of need for personal assistance, etc., I think is relevant. And maybe the other thing is highlighting the importance of this kind of multi-tiered kind of mix of measures. It's the pension, maybe in some cases it's an additional cash benefit, in some cases in-kind support, but also as we kind of mentioned, things like concessions and discounts, which also kind of contribute to that wider package, which in a sense address the disability. But I mean, if I think of subsidized public transport in many countries, it's not necessarily kind of couched in those terms, so that can be valuable. Thank you very much. Meredith.
Just echo the point about language and framing, like we often see, especially with care and support to older persons, it's very much based around a dependency model, which is slightly different from perhaps the way services are developed for persons with disabilities and other age groups. So I think there is a key issue about framing, but I think there's also an issue about choice as well. Like we are seeing increasingly both in-kind services, but cash for services as well, as is highlighted in a number of countries, and giving people the opportunity to perhaps, there's sometimes a hesitation about receiving in-kind services, and so giving them the flexibility would also perhaps increase the demand as well and uptake.
Thank you very much, Meredith. Raphael.
So this issue the other way around. So for BPC, when a person with disability gets to be 65, the treatment changes because the person does not have to go through the disability assessment anymore. For instance, if a person had a temporary disability, she would have to go through the assessment again every 2 years. So regarding the services, they exist, and if everything was like it should be as per the laws and the regulations, it would be wonderful. So if you are an elderly citizen in Brazil and you are lucky enough to live in a place where you have a daycare center close to you, where you have a social center close to you, where the national health system is working, you can get your hypertension or your diabetes medicine and the attention. You have a place where you can stay during the day, where you're going to be receiving specialized care. So it would be very good, but the problem is that there are many supply side issues, and we know that this is not the reality in all the country, particularly regarding daycare, for instance, is something that is only available in the larger cities and not for everyone, unfortunately. But there is also a very interesting issue. There is the demand side issue, particularly by the poor beneficiaries of BPC, because they don't use the services that are available as much as you would expect. So the level of utilization of basic services of social assistance by the BPC user is less than 3% of them use those services. And this is something that we still have to understand why. I think part of the problem is due to the feeling of disentitlement that these people have, and they simply don't know that some of the services are there and they can go and use those services and claim for them besides the benefit that they are receiving.
Thank you very much, Rafael. I think we didn't have the time to really go into all the issues which you mentioned a little bit with Cadastro Único, of information system and case management. Also, I think in many countries, we are struggling to identify person with disability and also carry out needs assessment that will allow more of this demand side and supply side coordination. So with this, we will unfortunately have to close our webinars, but we are going into the networking cafe. I will give the floor to Paola in a minute to lead us there. I just wanted to thank the interpreters and the captioners that have been with us. Of course, all the speakers. I really invite you to join the Asia Pacific Social Protection Online community to continue this conversation, and also to look at the paper that we shared, and please comment. You have our email address. You can pick any of us. In the paper, please share your comments. We will finalize this paper by the end of the year. And we really want this paper to be the start of a conversation on how social protection system can provide better support to older persons who experience disability. So with that, I thank everybody, and I would like to give the floor to Paola to lead us to the cafe. Thank you very much.
Thank you, Alex. Hey, everyone. Good morning, good evening, good afternoon. My name is Paula. I'm from socialprotection.org, and I'm going to give you brief instructions on how to go to WonderMe right now. We're going to have this informal networking cafe with everyone here. So attendees, panelists, organizers, they're all going to be there. They can all enter WonderMe. You will see now in the chat, there is a link that will go to WonderMe. It's a browser page. Once you enter WonderMe, there is going to be a request browser permissions, because you have to allow your mic and your microphone to enter WonderMe. Fernanda, I don't think the slide is working, but you will see here in a second the slides for WonderMe. And once you enter, you will be asked to put a photo and your name. There is also a quick icebreaker question, and then you're going to be in WonderMe. Right now, we have Marina Carvalho, one of our friends here from Social Protection. She's going to welcome you into the room, and I hope to see you all there. Please feel free to leave any messages. If you have any issues entering WonderMe, please send us a message. There is a chat bar here on Zoom. There is also a chat bar there at WonderMe. You can reach out to us and we'll be glad to help you in any way. Okay, so here you can see the slides. This is what you will see when you enter WonderMe. Don't worry, we're going to give you like a couple minutes to do this. There's transition from Zoom. So there is this button that says request browser permissions. You're going to allow your camera and your microphone. And then there is also a photo and also a place to enter your name. And if we can go to the last slide so everyone can see how it looks once we get there. Yes, so this is how WonderMe works. You will see that you will be represented by these little circles with your photos. To move yourself, you just need to drag the circle to next to another person to talk to that person. So once you are close to another person, you will be able to talk to them, and people outside of that circle will not be able to listen to what you're saying. So this way, we will be able to have a lot of multiple parallel conversations in one room. So I think that's it for now. If you have any questions, please reach out to us, and I hope to see you all there. Thank you.